Hi, sweetheart. If you'll just have a seat right over there for me, that would be perfect. Okay, thank you so much. All right, so I'm gonna ask you a few questions, if that's okay. I know that you're probably very eager to go home. I know that you probably don't feel very well, especially if you're in here. But I just have to get your name and your age really quickly, and then I'm going to ask you some questions, if that's okay. Okay. So, what is your name? And your last name? Okay. Perfect. And your age? Okay. And just to be sure, do you have any allergies? Okay. All right. Thank you so much for that. All right. Are you comfortable where you're at? Okay. Do you need any water? Okay. All right. So I'm just going to ask you a few questions related to today, if that's okay. All right. So, what seems to be bothering you today? Mm-hmm. Okay. And are you feeling dizzy at all or just tired? Okay. And did this start this morning or after lunch? Okay. Okay. All right, let's see here. All right, those were a little bit of the easier questions. So before I can call your mom and ask her to come get you, there are a few more things I need to ask. Okay. Do you have a headache or a tummy ache? Okay. Yeah. And do you have a sore throat or any sniffles? Okay. And right now, are you feeling warm or cold? Yeah, not your head, just like your full body temperature. Is it warm or cold? Okay, interesting. Okay. Alrighty, and on a scale of 1 to 10, how uncomfortable are you feeling? Like just sitting here, or like, when you're in class, like how uncomfortable are you? On a scale of 1 to 10, 1 being you're perfectly fine, and 10 being the absolute worst, like you need to be rushed to the hospital. Okay. Alrighty. Now I'm just going to ask you some specific questions just related again to today, but mainly just a few more questions. Okay. Did you eat breakfast today? Okay. And I know that we talked about lunch. Did you end up eating lunch as well? Okay. Perfect. And have you been drinking enough water today? Yeah. Sometimes if we just drink more water, we'll feel much better. So no water. No. Okay. Yeah, we might need to work on that. Okay. Yeah. More water, more water. And what class were you in when this first started? Miss Fitzpatrick. Oh my, can I just tell you that Miss Fitzpatrick has been here forever. She was my teacher. Yeah. I mean, no wonder why you were feeling bad. Okay, you didn't hear that from me, of course, but Miss Fitzpatrick. And a very, very important question. Is today a test day? Okay, are you sure? No test. Okay, and my second question, is today a gym day? Okay. Well, I actually added the gym day question onto our questionnaire sheet because I'm someone that never dressed out for gym. I know, it's bad. It's bad. I almost failed gym because of that, but this is not about me. This is about you. All right. Okay, so thankfully, the hard questions are out of the way. I mean, actually, all the questions are out of the way. I first want to say thank you so much for all of the detailed answers that you gave me. It's going to help a lot to reassess whether or not I need to call your mom and if you can go home. The great thing is nothing sounds too serious, of course. So that's good. Nothing is too serious, which we love to hear, but I am glad you came in. Instead of just sitting in class in pain, it's good to come in, get yourself nice and checked out. Okay, so with that being said, now is the fun part where I get to check your temperature and some of your vitals. Is that okay? That will actually be the main call for whether or not I get in contact with your mom. So let me put the questionnaire over here. Okay, so I just need you to relax for me. Okay, so just nice and relaxed. And if it's okay with you, I'm going to be touching your face, possibly your ears. Is that okay? And I'm only going to need one glove for this. I know it's flu season right now, and I really hope you do not have the flu, because that would not be good for me. No, I don't think you do, though. Okay, so your temperature. I'm going to do a hand check for the temperature. Is that okay? Yeah, I lost my thermometer. I know, that's like really not good for a school nurse to lose her thermometer, but my hands are magical. I'll know whether or not you're running a temperature. Now, earlier you had mentioned that I had asked you if you were feeling warm or cold. Yes, and your answer was suspicious to me, not because I think you're lying or anything, but because I think you might have a fever. Yes, okay. So I'm going to use my gloved hand, of course, and I'm just going to check your forehead. Have you ever heard of the wise tale Is it wise tale or wives tale? I think it could go either way, honestly, but the wise tale is if you use the back of your hand, you can tell better if someone has a temperature. That's why I don't even need my thermometer. And I was just using the front of my hand. So let me use the back of my hand. So just gonna place that right there. Perfect, perfect, perfect. And let me check your cheeks really quickly. Okay. Yeah. I know I'm checking for a while now, but it's because you are most definitely running a fever, and I really, really wish I had my thermometer. Okay. Moving right along. Let's go ahead and check your eyes. Okay, and then I'm going to check your ears as well. But if you wouldn't mind looking up for me. Thank you, thank you. Let's see here. And up, 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 up. And perfect. Can you look over to the left right here? Okay. Get right in there. And over to the right, right. Let's see. And perfect. And okay, I was gonna tell you to look down, but I think I've seen everything I need to see on your eyes, and now I'm going to check your ears. So let's go over to your left ear. Yep, just right there. And let me just move some of your hair out of the way. Okay, and let's check this other side. Look in here. Okay, this side is a little bit more dirty, but that's okay. It's okay. Perfect. And if you can just go ah and stick your tongue out for me. Good. Okay. Yep. Ah. A little bit more. Tongue out more. I know this is awkward and weird. Okay. I think I've seen all that I've needed to see. It looks like you need a tissue. Alrighty, well, let me grab my clipboard really quickly. And so, based off your answers and my diagnosis, it's your lucky day. And by that, I mean I'm gonna call your mom to come pick you up. It is not your lucky day, however, because I think you have the flu. I think you have the flu. Yeah, we saw swelling in the back of your throat. You did have buildup on your right ear. I'm not too sure if that is related to your flu symptoms, but you are running a very high fever. I wish I had an exact number for that fever to give your mom, but I do think that you're going to need to go see a doctor. Yeah, I'm sorry, honey, but you are sick. Yeah. Yep. And don't you worry. I'm gonna make a call to Miss Fitzpatrick. You know, honestly, I'm so surprised that she let you out of class. Yeah, she must have known you were sick. Honestly, that alone should have just told me. She doesn't let anybody leave her class for any reason at all. Okay, and I know we have it in the file, but I would rather just call your mom like right now, not have to search for your name and information. So, what is the best way to contact your mom right now? Is she at work? Okay. So go ahead and give me that number, and I'm also going to take her cell phone number as well, okay? And what is your mom's name? Okay. Okay. And that work number? Okay, perfect. And if I could get that cell phone number as well. Okay. And can you repeat those last 4 digits for me? Okay. Amazing. I'm gonna have you lie down. I'm gonna actually close the door to this room. I'm gonna shut the light off. You're more than welcome to lie down, or you can even, of course, get on your phone. Okay. Do you have your phone with you? Do you have your things? Okay, you left your things in Miss Fitzpatrick's class. Okay, how about I call Miss Fitzpatrick and I have a student come and bring all your stuff here. That way you don't have to go get it. You don't have to go back in there. Okay, but you do have your phone on you? Okay, perfect. So I'm gonna turn the lights off, okay? And I just want you to relax and you can close your eyes. This is a very, very safe space, okay? All right, well, I will see you when your mom gets here, okay?